So we want to welcome you to the first of 5 webinars celebrating National Health IT Week. There's a lot of really exciting things going on in Florida that impact just not those residents of Florida, but really nationwide. And we really welcome this opportunity to let you know what's going on, how you can participate, and really how it's going to impact your overall healthcare on a day-to-day basis. But let's get started with what National Health IT Week even is, or what even Health IT is. We say Health IT, we say health information, we say health informatics, we say health information technology, and it really is a lot of different things. It all kind of really boils down to the different tools, techniques, services, ways that providers are being able to connect to share healthcare information. Now, a lot of people think, oh, I don't want my healthcare information being shared, but it's really important to understand that the sharing of that information really does create a better opportunity for quality of care, coordination of care, and really kind of provides a seamless system by which you can access the healthcare system. Lots of things make up sharing of patient information. Lots of things make up the term interoperability. We have telehealth. We're going to learn a little about telehealth today. We have electronic health records. We have direct messaging, which is a secure way of being able to share that patient information. We have event notification, really cool service that you'll learn more about. We really want to encourage you to start looking at your patient portal. Use your patient portal. That portal can really help you maximize your relationship with your healthcare providers. So when we talk about health IT, health information technology, whatever you want to call it, it really is about the interoperability of all these different things that are going on that can, in the end, provide you better healthcare. And if you're a provider listening in, that allows you to be able to provide better healthcare, coordinated healthcare, getting your patient more involved in their healthcare. So interoperability, key phrase. So what are we talking about all week? We're talking about how health IT is really evolving. All of the things that we have been doing for the last almost 50 years, really kind of go into what's being looked at for the future. You know, we really like this graphic because it really shows you can remember the big days of the big server rooms where you had all these CPUs running and you had to have a mass of people just to keep the system going from day to day to day. Then the second picture shows the original desktops. Personally, we still have one desktop at our household, but those desktops were heavy, clunky, not very flexible, not very nimble. You know, then it got a little bit easy with some mobile computing, and now everything's on the smartphone. You know, anything and everything can be done with a smartphone. And I know as we look at the younger generation, my kids included, if they can't do it on their phone, then yes, it doesn't need to be done. And then lastly, we're looking ahead as to what's going to happen in the future. You know, I think a lot about just how things happen. You hear the term Internet of Things, and that really is just bringing all of this technology into more and more ways that it's easy for people to use, that people are able to access information, and that information can be shared. And all of it, again, goes to that total patient experience, how all this stuff can help that patient in the end game. As we're talking about technology, one thing I do want to remind you is that this webinar is being recorded. I think we said that at the beginning, but I do want to make sure that everyone does know that. See, just another use of technology. We're going to record this and be able to have it for you available later for playback. Next slide. So we talked about National Health IT Week. So really what we're doing in Health IT Week is really looking at a way to showcase health information technology. And it's not just us. It's not just Florida. It is all across the nation. National Health IT Week was founded back in 2006. And it really is just an avenue to create nationwide awareness, promote nationwide awareness, kind of get people talking the same conversation. It really focuses on the value of healthcare IT. A lot of times when you have the terminology, oh, we're using interoperability, we're using electronic medical records, we're using health information technology, health information exchange, it really is hard to quantify what that value is. So again, we're looking at this as a way to be able to share that information with you and help you better understand what kind of services are available to you. There's a lot of education through what they call partner-driven events. We have partnered with others. Some of these are listed on the screen. But most all states are looking at doing something during this week, partnering at the national level, again, to promote overall awareness of healthcare IT. Health IT. I keep wanting to say healthcare IT. Next slide. So this is the focus of Health IT Week. I won't really read all of it to you, but really what they're trying to do at the national level is help states, help providers, help patients, again, understand what is going on. Really want to support healthcare transformation. You know, just as how we just do things on a day-to-day basis, banking, you know, going to the gas station and using your debit card, just the day-to-day things, online grocery delivery, things like that, Amazon, how all of that has really changed how we do things on a day-to-day basis on our basic needs. Healthcare is the same way, and technology is helping to support that transformation. We really want to expand access to high-quality healthcare. We ask more and more and more of our providers. We ask more and more and more of our healthcare team. So technology is a way to give them some tools, some techniques, some services to be able to provide the same quality care that you're used to getting, that patients are demanding. And it really can facilitate some of that care delivery as well, if they're not constantly having to call around for records or repeat studies or really try to figure out what's going to be the best thing for a patient at any particular time. Then they can continue to focus on the patient and focus on providing the best healthcare experience to that patient. Economic opportunity, there's lots of cool things happening in the realm of health information technology. So we want people to know what's out there. You know, if you're thinking about, hey, I want a career change or what's something new that I can do, think about Health IT. There's a big need for programmers, developers, analytics, applicators, you know, application-driven writers. So healthcare IT really provides a lot of economic opportunity within the healthcare ecosystem. I like to use that word. And then the overall commitment to making healthcare communities healthier. If everybody is working together, sharing information, sharing best practices, sharing quality practices, then it really does make our community healthier. And as I tell people all the time, we are all patients. You know, I'm on this side of the fence today, you're on that side of the fence, maybe providing direct healthcare services, but at some point we are all going to be patients, and all of this kind of stuff really kind of help us as a patient as well. Next slide. So why Health IT matters? Well, we really see it as an engine for improvement and innovation. You know, just as things have evolved in everyday life, you know, I go back to Amazon. You know, I was a big holdout for online shopping for a long time, but now it is so easy just to go in, click a button, and before I even get home some days, my package is there. That's kind of what Health IT is doing too. It really is just an engine for improvement and innovation. And as we talk to our providers, as we talk to patients, as we talk to communities, what our message is there's all sorts of really cool stuff out there. We just provide that information. We want you to know what's available to you. And then just with any other service, you have to find out what it is that you need, what's going to work best for your practice, what's going to work best for you, either serving your patients or as a patient. So Health IT matters because it really is just that catalyst to do things differently, do things better, do things anew. Next slide. So here's kind of a highlight of all of the different programs that we're looking at. We have EHR, electronic health records, telehealth, cool stuff in telehealth, Florida Health Finder, all the various services under the Florida HIE. And what the purpose of today's webinar is just kind of give you a little snippet on all of those. We have some really great speakers lined up to kind of give you highlights of each of these different programs. At the end, I'll go through the list of activities for the week. We have some guest speakers coming in talking about different things on a more broader level as well. So again, if you want to type your question in, we'll definitely hold those. If you want to ask a question, please be sure to enter your audio pin, and we'll take all of the questions at the end. And I'm going to come back to this slide as well. So Carrie, kind of remember I want to come back to number 12. So let's get started. With our first one, Aaron Parsons is our HIE project manager, and he's going to talk about some of the services under the Florida Health Information Exchange, including what I mentioned earlier, event notification services, which is really driving a difference in the way people are getting their health care. Aaron?
Thanks, Kim, and thank you everyone for taking some time this afternoon to learn a little bit more about our various health IT initiatives. So yeah, I'm Aaron Parsons with the Agency for Healthcare Administration. I'm going to give a little bit of background on the Florida Health Information Exchange project and the services that are offered by the Florida HIE. So I'll start with a little bit of background. The Florida Health Information Exchange is governed by the Agency for Healthcare Administration, whose mission is better healthcare for all Floridians. So in everything that we do, better healthcare for all Floridians is our objective. The Florida Health Information Exchange, a little bit of background, has its origins in the 2009 HITECH Act legislation that not only set up the Meaningful Use Program for Medicare and Medicaid, but also provided funding to states to set up health information exchange infrastructure locally to assist providers in meeting meaningful use. So the Florida HIE has its roots in that 2009 legislation, and as part of that legislation and the funding that became available, the agency partnered with a number of different stakeholders across the state in order to assess and develop the statewide infrastructure. And so, of course, we worked with our federal partners at HHS, and then locally we worked with healthcare providers, with health systems, and with payers across the state, as well as with technology vendors and local stakeholders, patient advocacy groups, physician advocacy groups, a lot of different types of organizations that have an interest in this topic. And working with all of those partners, we developed the Florida HIE and the services that it would offer to healthcare providers in the state. And so currently, the Florida HIE offers 3 services. We have our patient lookup service, direct messaging, and event notification, and I'll talk about each one of those just a little bit. So I'll start with our patient lookup service. This service is built on the nationwide eHealth Exchange platform, and it allows providers to query for patient clinical records. So rather than having to, as Kim mentioned before, duplicate tests that have been done previously, this allows a physician who has access to the network to query the patient records of all of the other participants. And it allows them to pull back any records that come back for that particular patient. And that way they have access to that CT scan that was done just a month ago, rather than having to go ahead and perform another one, which adds to cost and just adds another layer of things that are really unnecessary when they can access the record that already exists. The service is built on a federated network, so each of the participants retains control of their own records. That way there's no centralized data repository that sits at the middle of the HIE. There are some HIEs that are organized that way, that do have a centralized data repository or a CDR that they operate with. The decision was made in Florida to operate as a federated network, and that allows more control and autonomy to reside with the individual participants. Working through the eHealth Exchange platform allows all of the participants to have common data standards, a common legal agreement, and common governance framework. So it really simplifies things in terms of health information exchange, rather than each health system having to negotiate one-to-one connections with every other health system or provider or payer that they're interested in exchanging with. The eHealth Exchange provides an opportunity for common standards across the board, a common legal and governance framework. And this common legal and governance framework covers over 100 million patients nationwide. So we really kind of tapped into this existing and very large network, and we're facilitating participation in that by health systems in the state of Florida. Participation in the patient lookup service helps providers to meet the HIE requirements of meaningful use. We won't get too far into the weeds on that, other than to say that it does assist providers in meeting these requirements and in receiving funding that assists them reimburses them for their electronic health records. So for more information about this, we do have a number of resources. There's just 2 URLs that are on your page right there. One is for the Florida Health Information Exchange, the Patient Lookup Service page, and then the other connects directly to the eHealth Exchange by the Sequoia Project. So that's our Patient Lookup Service. I want to talk a little bit now about our direct messaging service, which we have available for providers and health systems across the state that are interested. And this provides an opportunity to have affordable, secure, HIPAA-compliant email. It's a push model of exchange. So our query model, the Patient Lookup Service, is a query model where you search and pull back records, a retrieve model. This is a push model of exchange. So just like regular email, you send records and messages to other people. This is the same thing. It's just secure, HIPAA-compliant, affordable email. It's built on industry-developed direct standards. So that ensures that it meets the very high standards that are embedded in the direct protocol. It also ensures that you know who it is that you're communicating with on the other end, because it includes strict identity verification standards. It also supports the exchange of documents in any format. So just like your regular email, you can attach documents. I guess there's sometimes size limitations, but you can attach documents of any format in order to share those with others. This is the same. So you can exchange documents of any format, basically via email with other providers or even with patients. The direct messaging service offered by the Florida HIE is Direct Trust accredited. That means that users can exchange with a trusted nationwide network of over 1.3 million identity-proofed users. Every one of those 1.3 million users has had their identity verified through the standard process. Our local direct address book includes over 50,000 addresses in Florida, Georgia, and Alabama. So it really kind of opens up the universe of folks that physicians can communicate with using this service. It does assist providers in meeting the HIE requirements of meaningful use. And it's also relevant to conversations about direct is the fact that all meaningful use stage 2 certified electronic health records, so all EHRs that can be used to meet stage 2 of the meaningful use program are required to include direct. And what that means in practical terms is that there's going to be a much more widespread availability of this kind of service and more physicians that you can connect with and provide records to and exchange records with in order to improve patient care. So that's our direct service. And the final service that is offered by the Florida Health Information Exchange and that I'll be talking about this morning is our event notification service, also known as ENS. ENS offers real-time notice of patient-hospital encounters to healthcare providers and health plans. This is patient-authorized exchange, and this exchange is used to improve care coordination and transition of care. So a lot of the times when a patient receives emergency or inpatient care at the hospital, the patient's primary care physician or specialist isn't really notified of the encounter until several weeks or perhaps months later when they see the patient at their next visit, or perhaps they're never notified. And so having a service like the event notification service like ENS allows the primary care physician, the specialist, the ACO that a patient is a part of, that patient's payer, to be made aware that they had a hospital encounter. And that provides an opportunity for them to reach out to the patient, talk about follow-up appointments that need to be made and kept, to work with them on their medication, and to do all the things that are necessary to help that patient avoid an unnecessary readmission down the road. It also helps to reduce hospital admissions just by being able to know which patients are most often frequenting their local emergency department and working with them to get them connected with a primary care physician who meets their needs and who they're comfortable with. So it also supports, I mentioned ACOs, it supports value-based payment reform models like ACOs. We've had really terrific participation among our ACO partners. I believe we have about 25 Medicare ACOs across the state that cover over 300,000 of their patients using this service. So anytime one of those Medicare beneficiaries receives care at a participating hospital, that ACO is notified. So we have a really terrific participation in the ENS. It's been a really good project, and it's delivered really good results for all of our stakeholders. And again, for Floridians, reaching towards the agency's goal of better healthcare for all Floridians. Our participation includes 210 hospitals that together cover over 94% of all hospital beds in the state of Florida. So really broad statewide coverage. We have 10 health plans that are signed up to receive alerts on over 3.5 million members. And so they can use that data to improve the care that their members receive. And 23 ACOs and 3 provider groups that together are signed up to receive alerts on an additional 450,000 members. So together, that's almost 4 million Floridians who are currently covered by this service. And we have thus far, since the service was first implemented in 2015, delivered over 4 million total notifications. Next slide, please. Thank you. And so I'll real briefly just go over a couple of charts that kind of chart our progress with the service. The chart that you're looking at right now, the one in blue, shows from the inception of the service when we started covering with about 40,000 patients all the way through until August of 2017 when we covered just over 4 million. The next slide shows the number of alerts that we have delivered month over month. Again, very small numbers when we began the service because we were still working to bring hospitals and payers and physicians on board. But last month we delivered over 300,000 notifications. And we'll continue that trend going forward, and that's 300,000 opportunities to improve patient care. This chart just tracks the total cumulative alerts. So this is the total since the beginning of the service. I already mentioned just last month we broke the 4 million mark, and so we've had terrific progress on this. We're very excited about all of the services offered by the Florida Health Information Exchange and by the opportunity over the coming months and coming years to offer additional services that meet the needs of providers, of hospitals, of payers, and most importantly, of patients who are our friends, neighbors, family, and ultimately all of us. So that's all I wanted to share as far as the Florida Health Information Exchange goes. Thank you for your time, and thank you, Kim, for the introduction. I'll pass it back to you, Kim.
Right. And for those of you who've been kind of charting the progress of the Florida HIE, we'd realize it has kind of taken a while to get to where we are, but we really are starting to see that traction of providers relying on the information that we have available, really using that information we have available, seeing how they can use it every day in their practices. So event notification really does excite me. We hear a lot of great feedback about that because it is that real-time patient information that someone can use to make a difference. And again, with all of our programs, there's lots of really good things out there that providers and patients and anybody in the healthcare spectrum can really use. A lot of it is foundational upon having an electronic health record. Not all of our services require electronic health records, such as event notification, but Dylan Dunlap's going to talk a little bit about the EHR incentive program, what kind of progress we've made in the adoption of electronic health records throughout the state. His staff does an amazing job of getting all those applications in, getting them processed. So Dylan, tell us what's going on with EHR.
Hey, Kim, and good afternoon, everyone. Thank you for having me. My name is Dylan Dunlap. I am the Electronic Health Record Incentive Program Coordinator here in Florida. The program is more commonly referred to as the EHR Incentive Program. And today I'd just like to give you a little bit of background of how the program came about, what the program entails, some numbers from Florida in terms of payments, and then also looking at the overall goal of what the program wanted to accomplish. So the EHR Incentive Program was established in 2011 by the Centers for Medicare and Medicaid Services to encourage the adoption and meaningful use of electronic health record technology. And the funding for the EHR incentive payments is provided through provisions in the American Recovery and Reinvestment Act of 2009, specifically in the section referred to as the HITECH Act, which Aaron mentioned earlier and stands for Health Information Technology for Economic and Clinical Health. And the Florida Medicaid EHR Incentive Program is administered in Florida by the Agency for Healthcare Administration in accordance with federal guidelines. Now, there also was a Medicare version of the program, which was called the Medicare EHR Incentive Program, which was administered by CMS by that name. But in 2017, the Medicare EHR Incentive Program was rolled into another CMS quality payment program referred to as MACRA and MIPS. But here in Florida, the Florida Medicaid version of the program is scheduled to continue through 2021, although the last year to begin participation was 2016. So eligible professionals and eligible hospitals apply for incentive payments as they adopt, implement, or upgrade EHR technology or demonstrate meaningful use in subsequent years of participation. Eligible professionals are able to participate for up to 6 years and may receive up to $63,750. Eligible hospitals can participate up to 3 years in the Florida Medicaid EHR Incentive Program, and incentive payments are calculated based on individual hospital factors. Next slide. So eligible professionals and eligible hospitals must meet eligibility requirements established in the CMS final rule in order to participate. For example, eligible professionals must be an eligible provider type and must meet a Medicaid encounter volume threshold over a 90-day period, among other requirements. Providers are not required to demonstrate meaningful use in their first year of participation. There's actually a phase that's referred to as adopt, implement, or upgrade, which provides an incentive payment in the first year for the provider adopting, implementing, or upgrading to certified EHR technology. Now, we talked earlier that 2016 was the last year to start the program, so therefore the last year to attest to adopt, implement, or upgrade was 2016. All providers that received a payment in the program previously will attest to what's called meaningful use for the remainder of the program. And meaningful use consists of 3 stages: stage 1, stage 2, and stage 3. And each stage has a set of objectives and measures that the applicant is required to meet. And the different stages came about from the original legislation. There was requirements that CMS made the meaningful use measures more stringent as the program went along. And in 2015, CMS released a final rule that modified stage 2 to ease the reporting requirements and align the program with other quality payment programs. Next slide. So looking at the numbers here from Florida, as of September 22nd of this year, the Florida Medicaid EHR Incentive Program has paid over $552 million in incentive payments. You can see at the bottom of the table the breakdown for eligible providers versus eligible hospitals. We've made over 15,000 total payments in Florida to 8,755 unique providers and 182 unique hospitals. And as you can see, a large number of meaningful use payments for both eligible professionals and hospitals as well. Next slide. So talking about the goals of the EHR program, it was to promote adoption and meaningful use of certified EHR technology. And really it's seen as a building block of the larger vision of health IT as a platform that serves to improve communication between patients and providers, empower patients to be more involved in their healthcare choices, improve quality and safety by reducing medical errors, and promote cost containment through improved coordination of care. So we're kind of right in the middle of the program at the current time. I think one thing that can be said is there's a much greater number of providers and hospitals that utilize certified EHR systems than had the program not been brought about. And I think that's important as you listen to some of the other initiatives that we talk about during HIT week. A lot of those initiatives are built upon providers, hospitals, and patients utilizing the functionality in these systems. So if you are more interested in learning about the EHR program, as Kim will show you later on, we do have a webinar scheduled for Thursday at 1 p.m. If you're not able to make that webinar, on the last slide of this presentation, we do have the link to the Florida Medicaid EHR Incentive Program website, and there is an email address where you can send your questions related to the EHR Incentive Program. Thank you, and I'll turn it back over to Kim.
being an outreach coordinator for the EHR incentive program, I am a little partial to that program. But like Dylan said, it really can be a foundational building block for a lot of other these health IT programs. I do want to remember people that 2016 was the last year to begin participation, but we really are working with providers to continue their participation. Things have settled down a little bit with the meaningful use measures that people have to meet. We've got a lot of really good resources kind of promoting those. And as you said, we'll talk more about that on Thursday's webinar. But let's go on. I don't want to run out of time. Next, we have Pamela King, who is the HIT Outreach Coordinator. I work with Pam on a lot of different levels, a lot of different initiatives. She's been spending the last few months really focusing on telehealth based on the governor's orders, so that does kind of preempt a lot of things. So Pam, why don't you tell us what's going on in telehealth?
Thanks so much, Kim. I'm so glad to have all of you with us today. Just a little bit of information about telehealth, and Carrie, you can go to the next slide for us. As Kim mentioned about, last year, a law was passed that established a telehealth advisory council. And so 15 members were appointed to this council, and of those two, one is the Secretary for the Agency for Healthcare Administration, Secretary Senior. He is the chair, and also the Surgeon General for the Department of Health, Dr. Phillip. And that, and they actually, the Secretary for ACA and the Surgeon General also actually appointed the other 13 members to the council. That legislation that was passed also required the agency to basically do a survey of what is going on in Florida as far as telehealth. How is it being used now? And what can we do to capitalize on how it's being used and make it more accessible for others in the state of Florida? What barriers are being seen by practitioners? And so that information was put together. There was a survey done by our agency, the Department of Health and the Office of Insurance Regulation, to our licensees. We got feedback from them letting us know, hey, this is what's happening in the state of Florida. Those survey findings were provided to the governor and the legislature, but also to the advisory council, so they could take a look at, hey, what are some of the barriers that are out there that are being seen? And the council for the last year, a little over a year, has been looking at those, the findings from the survey, doing some research of their own, getting some information on reports that are done out there, some studies that have been done, getting input from stakeholders. Almost 100 stakeholders have shared what they're doing, what they've seen, studies that they have provided to the advisory council, letting them know, hey, this is what's going on. One of the things I do want to point out on the next slide, Carrie. One of the things that I wanted to share is, as part of that survey and information that we got back from our stakeholders, are some of the benefits that at least our licensees here, the agency, the facilities in the state of Florida are seeing. You'll notice a lot of times we hear it's a patient inconvenience, but what really excited me about the information we got back is not only was patient convenience highlighted as a benefit from telehealth, but better care coordination and better patient outcomes were also highlighted. And I'll share a couple of examples of how telehealth is being used in Florida a little bit in just a second. But I was really excited. If you're looking at this and going, wait a minute, that's way over 100, that's because this was a select all that apply question to our licensees. And so those were just 3 of the things that they found that were really beneficial. So the council actually looked at the survey, and there were several things that were highlighted as being barriers. And then based on that additional research and input from stakeholders, the council basically came up with a list of either 5 or 6, depending on how you count them, items that they believe are things that the legislature needs to consider, and these are things that are going to be in their report. The draft report is actually online in the meeting material, so if you want to take a look at that, you can. But one of the big things that they found was a lack of a telehealth definition here in the state of Florida led to a lack of clarity of what telehealth is and how it can be used and who can use it. Some of you may be listening to this call going, well, I don't even know what telehealth is. Well, for those of you that don't know what telehealth is, it is basically technology, communication and AV technology that allows a practitioner to see a patient virtually. And so the definition is a little longer than that, but for our conversation, if you have no idea what I'm talking about when I'm talking about telehealth, it's basically a practitioner being able to see their patient virtually. We do have some definitions of telemedicine in the state of Florida, but stakeholders really came back time and time again with that causing confusion on whether only physicians could treat their patients through this available technology, or is it broader? And so telehealth is a little bit broader connotation to it, and so the council really felt like that was what we need to define in the state of Florida. Health insurance coverage and reimbursement were both areas that the council thought provided a barrier as far as there not being parity of coverage. The information we got back from insurers really indicated that, they utilize or they pay for services, telehealth services, mainly through the Medicare plans and Medicaid plans. And so we're hoping to see that grow in over the coming years. And I think the recommendations from the council to the legislature is that, that there should be a requirement that it be covered and reimbursed. Licensure standards, although some stakeholders indicated they thought requiring licensure in Florida was kind of a barrier, the council really made a determination that because of patient safety and security standards, they really felt that a practitioner that was seeing a patient living in Florida, whether it was in person or virtually, needed to have a license in Florida, and made some recommendations on maybe how that licensure process could be streamlined with licensure compacts and other ways that maybe some of those issues could be overcome. Patient-provider engagement, one of the things that we heard a lot was the need for engagement with both patients and providers in education. And so part of that engagement is education on the availability of telehealth. It is currently not illegal to provide telehealth services in Florida. And so, and there's some misnomers about that. Whether you can, there are some providers out there that have actually been successful in negotiating with the health plans that they work with to get reimbursed for services. And so that is great to know. And if you're a provider out there wanting to engage in telehealth services, then by all means, there's nothing that prohibits you from doing that. As long as it's within the scope of your practice, and that is under the purview of the Department of Health if you're a practitioner. Technology is another area that came up as a potential barrier, but what we discovered is the technology is there, it's available. Broadband capabilities are available throughout most of Florida. I think we have 97% of Florida that has broadband capabilities. In those areas where we do not have broadband, there is the capability of, you can still use mobile or data connectivity with phones, iPhones, and iPhones have actually opened up opportunities for telehealth because a doctor can actually see their patient and the patient has just a cell phone to communicate with them. So just here's a few examples of telehealth and how it can be used in the state of Florida. Mayo Clinic is using telehealth for stroke care. They partner with smaller rural hospitals. And so if a patient in a rural area goes into their small hospital, acute care hospital, and they are showing symptoms of having a stroke, the hospital and Mayo Clinic will communicate, and there's a specialist that will be right there that can communicate with the patient in that hospital. They do some testing so they can treat for stroke right away. For those of you that know anything about stroke, the faster that a patient is treated or worked with, the more chance that they will the mortality rate decreases and the impairment rate decreases as well. So this is a really exciting thing that Mayo Clinic is doing with smaller hospitals throughout Florida. Another example of telehealth, I talked a little bit about, it's not just medicine as in medical doctors. We saw some really neat examples of the use of telehealth by allied healthcare providers. The speech-language pathologists and audiologists came and did a presentation for the council, and they are using it to adjust cochlear implants, to do rehabilitation, working in schools with children when there's limited resources in the schools, and so the speech pathologists can't go to necessarily all the schools where they need to provide as much treatment, and so they can attend these schools virtually and see more of the children in the schools. So it's really exciting to see that. And also working in nursing homes with people that have had strokes and working with them on their ability to swallow and also cognitive rehabilitation for the patients in nursing homes. So that was really exciting to see how the speech pathologists and audiologists were using telehealth. And then a final example was one that was done in nursing homes. And right now, this was a study that was done in New York facilities, and this nursing home actually used telehealth to treat patients off hours. So during regular hours, 8 to 5, the nursing home physicians worked with and treated the patient, but during off hours, after 5 and on weekends, virtual physicians were used to take care of the patients, so that the physicians at the facility had actual time off, and those virtual physicians were able to, be there and give, in some instances or several instances, give guidance so that patients would not be transferred to hospitals. And one of the big expenses for nursing homes is, in off hours, if something happens with a patient and you call the physician, just based on that over the phone, what's going on with the patient, to be safe, a physician's going to transfer that patient to the hospital just so they can get checked out. And in many instances, those patients have to be transferred back. Well, when you're dealing with older, fragile patients, of course, that transfer is even dangerous. So utilizing telehealth, these physicians are able to look at the patient, see what's going on with the patient, and make a better determination on whether that patient can be treated there at the facility or whether they really need to be transferred. For those of you that want more information, if this just piqued your curiosity, what's going on? I want to provide telehealth services or learn more about how I can provide telehealth services. There's some resources for you. The Center for Connected Health Policy is a national telehealth policy resource center. So you can learn about current and pending laws for federal and state. So if you have Medicare patients, you know that there's some laws out there that limit who can be reimbursed for telehealth services, and they keep an eye out on that. And then in our area in Florida and Georgia, Alabama, there is the Southeastern Telehealth Resource Center. They have all kinds of educational and technical assistance they can provide to practitioners interested in offering telehealth for their patients. And then you can always contact us if you want more information. If you're interested in what's going on at the state level, you can go to our website, and I believe that's going to be provided at the end of the entire webinar today. So that's all the information I have on telehealth, and I'm going to turn that back over to Kim for our last presentation.
So a lot of really cool stuff happening in telehealth, and we've learned a lot about the services that are being offered throughout the state and a lot of the potential. Quickly, we want to show you an additional resource. I know Jess, she can talk really quick. So Jess, just talk a little bit about Florida Health Finder and where people can find more information.
Sure. Thanks, Kim. Florida Health Finder is the website where you should go to find information about the 49,000 healthcare providers licensed by ACA in Florida. So on Florida Health Finder, you can search licensure information for those providers, inspection reports, sanctions, final orders. You can also compare providers. You can compare pricing and volume information for procedures and conditions at Florida hospitals, and you can compare occupancy information for inpatient facilities. Florida Health Finder also has an extensive researchers and professionals section where you can look at data summaries and reports from different departments at the agency. There are resources for consumers that explain all of the different types of providers that ACA licenses, such as nursing homes, hospitals, assisted living facilities, emergency departments, and you can learn about the different data options that we have. We order data here. People who are professionals and have questions about ordering data can find information about that process on Florida Health Finder. On Friday, I will have a full 1-hour webinar where you are welcome to come and we will walk through the entire website and take a look at all of these features. So if you're interested in learning more, please join me on Friday at 10 a.m. to learn about Florida Health Finder. And back to you, Kim.
Great. Florida Health Finder has actually been around for quite a while, but we're really just being able to get the word out, and people are really being able to realize how much good information is out there. So if you've not been on a Florida Health Finder website webinar, I definitely encourage you to join us. And just to kind of cover all of the different webinars we'll have this week. Carrie, do we still have that schedule slide? So lots of good stuff going on this week. There's lots of different ways that you can participate in National Health IT Week. Also, just know that we have webinars and workshops and all sorts of events, you know, aside from just this 1 week. But tomorrow we're really going to highlight event notification services. I know that Erin's got a couple of participants lined up to kind of give you a perspective of how they're using it for their system. How it can really benefit things or show you ways that you can use it within your own healthcare system as well. Wednesday, we're going to have a speaker talking about privacy and security with a focus on direct messaging. Every day there's a data breach. Every day we hear of information being released. So come on Wednesday, we'll find out more information about those breaches and ways that you can protect yourself, not only as a healthcare provider, but also personally. I mean, again, we're all patients and we all have data that can be breached. Thursday, we're going to talk about the EHR incentive program. We're going to kind of do a walk back from the inception of the program, look at some of our numbers, and kind of look ahead at where the program is continuing through 2021. And then Friday, an exciting panel. We have some national speakers lined up just to give their perspective of where health IT is going. We kind of know where we are, we don't know where we come from, but what can we expect in the future? So great ways to participate. Carrie can talk a little bit how you can register for these webinars. I think we also have a contact slide for the various services that we talked about today. Yep, good information out there. Like I said, Florida Health Finders webinar is going to be on Friday, or you can email Jessica directly and get some more information about that. And Carrie can tell you how to register for all of the different webinars this week. And we have just a few minutes left, so let's see if we have any questions.
Hey, Kim. Yes, if attendees would like to visit the www.florida-hie.net site, there is a link to all those webinars to show you how to register and get involved. And let's see if we have any questions. Now remember, you can raise your hand using the little hand button in your control panel, or you can type a question into the question pane. So this is your opportunity to ask all these great presenters any questions you might have. Additionally, if you want to wait and attend one of the webinars throughout the rest of the week, we can let you do that. There will be more time focused on each of the different initiatives, and so those will be good opportunities. Let's see, we do have a question from Cheryl Gamble. Cheryl, I'm going to go ahead and unmute your line.
Hello.
Hello.
Hi.
I just have a question regarding the notifications. How are the doctors or the hospitals notified when information is updated on a patient's profile?
Let's see, Aaron, you want to take that question?
Sure, I'm happy to. Thanks for the question. So there's a couple different ways that doctors can be notified. So that the doctor, in order to receive the information, she or he needs to provide the name on a list of patients that they want to receive notice on. So we need to have that list up front because that's what's matched against the hospital data. And once a match is found, that information can be routed to the physician through direct. We talked about, we have our direct messaging service that I mentioned as part of my comments. A lot of physicians have their own direct service already, so it can be routed by direct, and that can be in real time as they occur, or it can just be batch delivered once or twice a day, which oftentimes fits a little better with office kind of business processes. So it can be delivered by direct, or it can be delivered by SFTP, and that can be set up by the vendor, or if the physician already has a vendor that they're working with, it can be set up on the physician side. So those are the two standard options. We also have, there is another option that allows physicians to access it through a web-based interface that is known as Prompt. And that just allows you to kind of log in and manage the information from there. So those are the three standard options, are SFTP, Direct, and Prompt.
All right, thank you.
Certainly.
And I encourage you all to dial into Aaron's webinar tomorrow. It's going to be very informative, and it'll be great to hear from actual participants and learn how they're getting value out of the event notification service. So let's see, do we have any other questions? Let's see, I do not see any more hands raised or any additional questions in the question pane. So I think that's going to wrap it up for today. We sure appreciate everyone for joining us for this kickoff event for National Health IT Week. The agency is very excited to be a participant, and we hope that you'll join us for the rest of the webinars throughout the week. Thank you so much.
Thanks, everyone.